Granted. All right, you got to be done by 3 o'clock, right? You have somewhere to be at 3?
Yeah, I've got
okay.
a bunch of folks from Lily.
Cool. Well, I'll get this going, and we'll get out of your way, and we'll edit this up, and hopefully we get some good stuff here. Okay, you ready?
Yep.
Okay, here we go in 3, 2, I'm going to get this out of the way. 3, 2, 1. Okay, so as most of you know, I've been talking a lot about this year's Big Steps race, the Big Steps 2,301K, Cowtown to Beantown, and we're raising money. We're having a competition between Kansas City and Boston to raise money for the KU Cancer Center and for Beth Israel Hospital in Needham, Massachusetts as well. And to talk about what we're going to do with some of this money and the importance of this year's event, we are honored to be joined by the president of the KU Cancer Center, a person I've gotten to know over the 8 years we've been with the foundation, Dr. Roy Jensen. Dr. Jensen, how are you doing? Thanks for joining us.
We're doing great, Nate, and so thankful for you and the rest of the Big Steps board for putting on this event despite, kind of a pretty strong headwind here.
Well, you know what? Look, it's obviously a challenging time for everybody. It's a challenging time for philanthropies, but it also is an important time for philanthropies because my guess is that most of the causes that philanthropies are taking care of actually need more help than they even normally do during normal times. And that's what we wanted to talk to you about. So maybe you could start by just telling us what are some of the biggest challenges that the KU Cancer Center is facing in the course of this pandemic?
I think it's the biggest message I would have for folks is that it's been an evolving challenge, and that's because as we learn more about COVID, we adapt and move forward, basically. And most of us have actually been asked if we don't have clinical duties to work from home these days, and so we just come in when we have some clinical responsibility, and the rest of the time, we're on Zoom meetings and phone calls and writing and doing those sorts of things. But from the very beginning, our major goal throughout this pandemic is make sure that our patients are as safe as possible while we're administering their cancer care. And so we're super excited to be working with you guys on what I think is a really innovative and creative approach to make sure that our patients are safe during this pandemic.
Yeah, and we'll get to that in just a moment. But you mentioned the continual learning process that the entire scientific community and medical community is going through when there's a new virus, a new pandemic. And what can you tell us about what you've learned over these few months as it relates to cancer patients, people that are battling cancer? How at risk are they to this virus? Obviously, there's only a short period of time that you've had a chance to study it, but what have you learned so far about how it relates to the people you're treating?
Well, I think, a number of things have been figured out. One of which is that cancer patients undergoing treatment, and whether that's surgery, radiation, chemotherapy, bone marrow transplant, you have it. They are at significant risk if they become infected with COVID for very serious complications, even including death. And so we want to do everything possible to avoid any of our cancer patients being infected with this virus. And some of the good news is that we found that kind of the standard infection control, playbook that we've had for decades, even extending back to the 1918 pandemic, is still just as valuable today. Wear a mask, socially distance, make sure that you wash your hands, and eventually we hope we'll have a vaccine against this virus. But in the meantime, those three things right there will go a long way to helping tamp down this pandemic.
But these patients of yours, a lot of times they're receiving these treatments that you just referenced, chemotherapy, radiation, immunotherapy, whatever it is. I'm assuming they can't do that via conference call.
They
or,
cannot.
or a Zoom call? They've got to, do they have to, most of them come into your facility? How are they receiving their treatment during this time?
Yeah, that's absolutely true, Nate. We a limited number of patients. We've been able to utilize different formulations of their medications so that they can take an oral pill and they can stay at home. But that's really a fairly small percentage of our folks coming into the cancer center. And so we've really focused in on making sure that our environment is as safe as possible. So everybody has a mask on. Everybody, after treatment, we do a thorough cleaning of the room. And making sure that if there are procedures being done that will generate aerosols or droplets, respiratory droplets, that our folks are wearing N95 masks, which is the highest kind of level that you can get outside of a biosuit. And so those things have resulted in some really good results for us in that we have not seen any transmission of the virus to our professionals uh, since we've instituted those policies, or the other way around, the virus being transmitted to patients. And so those infection control protocols are really critical to delivering high quality.
What about testing?
So that's a great question, and as you know, the federal government has essentially told the insurance companies that you need to pay for testing in a situation where it's clinically suspected, and they've also agreed to test patients whenever they're about to undergo some major treatment for cancer. What has not been covered is kind of the other side of the coin, and that is making sure that the personnel administering these therapies are also COVID-free. So that is not reimbursable. And so, one of the things that I think I find really great about this year's run is that it's going to help provide us with the resources to make sure that our personnel are COVID free when they're administering.
Yeah, so that's for our audience out there. That's exactly what we're going to be doing with a lot of the money that we raised with this Big Steps 2301K this year, is providing the resources to the cancer center so that they can test their own employees to make sure that the people that are providing treatment to cancer patients are in fact COVID free. So with that being said, I'm guessing it's something I haven't really thought about. When I had my first conversation with you at the time, I didn't realize that this was something you almost just assumed, well, hey, they're working at a hospital, they must all be getting tested. But I guess if you think about it, that wasn't exactly in the budget when you probably made out the budget in 2020 for all of the expenses that you have.
That's right. Yeah, you're exactly right. So, I think, frankly, our national response would have been much better in terms of developing testing on a scale that could enable us to really track this virus in a much better fashion, and also just as important, the contact tracing. And if there is a positive case, making sure that we identify all of the people who come in close contact with that individual, track them down, get them tested, and have them isolate themselves to try to tamp down the spread of this disease.
Have there been a lot of added expenses to the cancer center in terms of all the things you just talked about that you guys didn't see coming before the pandemic hit?
Oh, no question. I mean, our personal protective equipment bill is, probably over 10 times what it would be in a normal.
Wow.
So, that in and of itself is huge. And it's also impacted, our revenue streams, because early on, in an attempt to kind of depopulate the health system environment, we canceled many cases that were not absolutely critical that they be done. So any type of surgery that was not emergency, any type of procedure that not impacting a patient's longevity or whatnot, that all had to be canceled and pushed back. And so most hospitals experienced huge losses in terms of their downstream revenues.
So this, once again, I'll say to our audience, this is another reason why what we're doing with the Big Steps 2301K this year is so important. You can imagine the hospital situation. They're trying to administer cancer treatments to people. They've got this mountain of additional expenses that they've already incurred, and then they're not going to have any federal funding to actually get their own employees tested, the people that are actually administering the care to our cancer patients. That's where we step in. We have a chance to help out. And Dr. Jensen, I really appreciate your time. Any other final thoughts you have for the people that are watching about what we're all about and what you guys have going on at the Cancer Center?
Well, again, I just want to thank Big Steps, and I'm so sorry that we don't get to have the event out at the Edwards campus. But I love that course. It's the only 5K I've ever seen with kind of a suicide hill at the end. And you've run a 5K when you get done with that course, and it kind of separates the men from the boys here. So it's a fun course, but I'm sure the virtual event will be a lot of fun, and you've done a great job in terms of coming up with this challenge idea. I think that's going to be a lot of fun, and I think we play New England later on, so we need to do something in conjunction with that.
Well, in fact, I'm glad you mentioned that, because this is complete serendipity that it worked out this way. But the first day of the competition, Cowtown versus Beantown, is Sunday, October 4th. That turns out to be the same day the Chiefs play the New England Patriots. So we got the competition going. I actually am of the opinion that in addition to getting back to the in-person races that we're going to do in Boston and the Edwards campus going forward, this could become a tradition as well. Kansas City versus Boston. We have this competition, 2 weeks, see who can do the most miles. And I'll remind everybody, doesn't matter if you walk, doesn't matter if you run. We just ask that you don't just count your normal steps when you're walking around the grocery store. We want you to go out and get some exercise. You go for a 1 mile walk, you register, you put that down. Every single mile is going to count. If we make the 2301K that it takes to get from Kansas City to Boston before the Boston folks get to Kansas City, our sponsors are going to kick in twice as much money. And hey, at the end of the day, every person that registers and competes is going to be helping us raise money to help cancer patients both in Kansas City and in Boston. And that's what it's all about at the end of the day. So you can see the logo there, BIGGSteps.org is where you sign up. Get everybody you can. Dr. Jensen, you got to talk to everybody you know, get them to make sure they get their steps in, they walk in, they're running from October 4th to the 18th. And we'll try to raise as much awareness as possible, too, for what you guys are trying to do. Keep up the great work at the Cancer Center as well.
That sounds awesome, Nate. And again, appreciate so much everything that you guys do.
All right, that is Dr. Roy Jensen, the president of the KU Cancer Center. We're going to help them out. They need some help. They've got the government funding to make sure that patients who might be suspected of having COVID can get tested, but they don't have the funding coming from the government to take care of actually making sure that their employees and the people who are administering the care to our vulnerable cancer patients. We heard Dr. Jensen say it right there. These are the people who are at high risk more than anybody else during this pandemic. It's our responsibility to help them out as much as we can to keep them safe, and that's what we're going to do. Again, go to BIGGsteps.org and sign up. That's Dr. Roy Jensen. I'm Nate Bukaty, and we'll be coming back with some more content on Big Steps for you later on. See you, everybody.
Bye-bye.
Well, all right. That was good. Thank you very much.
Super.
I'll record this. I can send it on to you guys. You can plaster it wherever you want. If you want to, promote it on your social media pages, and we'll get it out on the 810 stuff and on the Big Steps pages too.
Well, while I got you here, were you able to get the right social media leverage from our folks? because you reached out and you said you needed somebody to help on our end.
Oh, on some things to put out on social media.
Yeah.
I'll check with my sister on that because she's kind of handling that
Okay.
that stuff. So I'll ask her and make sure she got what she needed.
All righty. I was checking with some folks in endowment today, and we were a little unclear about that. So we just want to make sure we make that clear.
Okay, I'll find out and I'll let you guys know.
Okay.
All right. See you, Doc. Thank
See you,
you.
buddy.